Good morning and welcome to KNDI ATRI Live. I am your host, Wangara Laura Cheng, and I'm delighted to have you here with us. So when you're shopping, many of us come across products that are written rich in calcium, high in protein, supports immunity. But do you ever wonder how these nutrient claims are assessed before they reach you as a consumer? So today we're going to discuss on the role of KNDI in the active review of foods with nutrition claims from manufacturers in the industry. And we are joined by Senior Dr. David Omondi Okeyo, an advanced public health nutrition scientist who will take us through this topic. Welcome, Dr.
Thank you. Good morning.
Good morning.
Okay, good morning, Laura. It's very early in the morning, eh? And that's a good topic, yes. So we are here again to inform Kenyans, and that is within the public information domain of KNDI. So I'll be talking both as an advanced scientist in public health nutrition and also as a CEO for the Kenya Nutritionists and Dietitians Institute. Just before this, as you have said, a lot of claims are on packages of food products in the supermarket.
Yes.
At the moment that I talk, we have over 390 companies that are selling products, about 1,415 products with claims on the package. You'll notice that all of them have S mark from Kenya Bureau of Standards. But we are not sure of what the content is in relation to human health. People are very happy. The Kenyans are very happy. They walk into the supermarket and pick a few products here and there, and then they consume them. Nobody bothers. However, we have a few products that have gone through the test of science when it comes to matters of nutrition claim from the KNDI perspective, which bear KNDI logo. The unfortunate thing is that that is the one where many of the competitors are focusing on. They have gone through a process which will make the Kenyans have confidence in their product, but many people are fighting them, and they're not talking about the ones that do not have labels. That is very unfortunate, and I think that is what we are going to focus on today.
Yes.
So to begin with, let me say this. When the Nutritionists and Dietitians Act was ascended to in 2007, under miscellaneous provision, section 36, part 2, it had a provision which was talking about any person who markets food and nutrition supplement without analysis, without certification, and without registration by the council commits an offense and is liable on conviction for a fine not exceeding 200,000 shillings or imprisonment for a term not exceeding 2 years or both. So this was a provision that was given to those marketing products, which means in a way, KNDI was supposed to validate with the analysis and certify all food products with nutrition claims. So as a good scientist and within the legal framework, we realized that it was necessary that we also have a provision of active review. That is in the main part of the act. And so we came together and then later on decided that we include active review of food in our act. And so Parliament, in their wisdom, gave us an additional function under Section 6J. We said working jointly with other bodies, participate actively on review of food, food supplement, and fortifiers with the nutrients claims. So when we talk of food, we are talking about the products that we consume from the supermarket. And when we talk about claims, we are talking about any nutrition or specific or nutrition sensitive claim on that product when it comes to well-being and human health. And so active review of food in this context means that you either use science or you provide expertise that would reaffirm to the consumer that what is claimed on the package is actually what is in the content. Now, in the same act when it was amended in 2019, it was also the wisdom of Parliament to include a component in the Food and Drug Authority and the Health Act. And so they indicated to us that within our act, we will participate again actively in the review in the Committee of Food and Drug Authority within the Health Act. That is number 21 of 2017. So this is in our act. What this means, therefore, is that when we are participating in the committee, then we provide technical expertise. And that would include even approval and endorsement of certain contents or products that we find in the public domain.
Yes.
Now, this is the mandate of KNDI. And so KNDI is legally mandated to review food and food products, fortifiers, with nutrients claims, including food supplements. So I know that there are many of the members of the public or Kenyans, and some of them are also holding offices that have questioned a lot about the mandate of KNDI vis-a-vis that of Kenya Bureau of Standards.
Okay.
And I want to be very clear again. I've said it before. I will say it again, just as part of this introduction. I would want to say that Kenya Bureau of Standards is an institution that is purely responsible for being a custodian of standards. And most of the time, we have Kenyan standards which are customized from Codex Alimentarius. Now, Codex Alimentarius provides bare minimum standards for food products, which KEBS uses sometimes also to put the S mark on food products. Sometimes we call it the diamond mark. Now, up to that point, the mark only represents conformity to standards. That has nothing to do with linking those standards with the human health. So that was a gap, and that is a gap that KNDI is filling. So you'll find that in the provisions of our mandate, we actively review from the scientific perspective of the product claims on the package vis-a-vis human health. And this also includes the value chain of safety when it comes to nutrients. So we talk about the process safety value chain and also the nutrient safety value chain, which KEBS doesn't do. Many times they've said that even to members of parliament, that they don't do tests. They rely on manufacturers' specifications and they rely on manufacturers' integrity. But what if the manufacturer is not doing the right thing? There must be a clear review of the value chain process from raw material entry to the final product. And then also looking at the nutrients which are claimed and how those nutrients affect human consumption when it comes to how much you can consume, or when it comes to who requires what when there's a deficit, because we all have different variations when it comes to consumption and the need. So I wanted to set that background for today's discussion and wait for you what else you want me to talk about before I get deeper to this.
Thank you, Daktari, for that bold and a good basement for starting this conversation. So now, Daktari, many Kenyans know KNDI as a regulator of nutrition and dietetics professionals, but from our strong introduction, we now know that KNDI has also been mandated to review foods with nutrition claims. So now, could you please explain the role and why it is important for KNDI to review these products to inform consumers and promote credible and science-based nutrition information on the products or
Okay.
foods.
I want to say this. The Act, which is Cap 253B, which of course, if you look at it very well, it gives a clear mandate for regulation of professionals, but also give a clear function of regulating the profession. So there's a difference between professional and a profession. That is why if you get into the functions, there is the aspect of quality assurance.
Yes.
Now, what is the profession? The profession is nutrition and dietetic service delivery. That is a profession.
Okay.
And the professional is a trained person to deliver nutrition and dietetic service in any setting. Now, the setting can be the hospital, the community, general public space, the food industry. Sometimes when we talk about food industry, it even includes hotels, specialized hotels. And we can also find them delivering services beyond even as crews in the airlines. So that is the profession we're talking about. So the mandate of this act was to regulate the professionals and also regulate the profession by ensuring that there's quality assurance. Now, in that context, the Parliament, in their wisdom, gave us regulatory functions as well as service-oriented functions. And so when we talk of service-oriented functions, it's like we take lead as professionals to see how best Kenyans can be educated on dietary habit. We also take lead to train professionals to deliver their services effectively. And that is why when it comes to service ends products like the food products with claims, which get into the market and Kenyans purchase from the supermarkets or any other outlet like retail shops and hypermarkets and etc., we must therefore use our professionals to ensure that the service provided when it comes to marketing of such foods are backed up with strong knowledge for the consumer, with strong knowledge for the user of that product. And that is why, in our wisdom, because we are lead scientists,
Yes.
it is the professionals in nutrition and dietetics, particularly those who have grounded themselves in food science and nutrition, that would assure Kenyans that what is claimed on the package is actually authentic,
Yes.
is good for their health, and has no element or possibility of causing any harm.
Okay.
KEBS does not do this. They check the conformity with the standards. So you can conform, but the conformity might be detrimental to the health outcome. A product can conform to the standards or specifications,
Yes.
but it might be toxic to a consumer. For example, if you have bare minimum fortifiers within a food product, let's say mineral fortifiers like zinc.
Okay.
Yes, zinc is needed for various functions in the human body. But not all individuals require the same amount of zinc at the same time. So the consumption of a product with zinc would require a targeted approach for the need that is properly identified by science. So it is not blanket consumption of zinc, because some will need that zinc, others don't need it because they have consumed enough of variety of foods that has provided them with such minerals, and so the content of zinc in their body is within the recommended allowances or recommended ranges. So such a person, if you add them more zinc, you can cause toxicity.
Yes.
So in a case like that, the nutritionist can explain that. But the conformity institution can only tell us that they are conforming to the specified standards of production when it comes to specifications and the range amounts required in a product. So that is why it is important for nutritionists to now come out clearly and create awareness when it comes to food labels, the claims that are on the labels on health matters and well-being must be those that are proven. And that is why KNDI is doing a comprehensive value chain for process and also product content. Now, I want to say this. From the time that this act was amended in 2019 to give us more powers, so far we have handled about 5 products, about 5 companies producing products. And I want to say that we have reviewed the value chain process for Weetabix original brand. That is Weetabix original brand. Weetabix has so many other products that they sell, but the one we are talking about is the Kenyan-based product which is manufactured within Kenya. It's called original brand. That is the one where you will find KNDI logo on it. We have reviewed Brookside products, probiotics. That is milk probiotics from Brookside. We have also reviewed fresh fries from Pwani Oils Limited, which is purely oleic acid and as essential fatty acid. We have also reviewed the Royco Mchuzi Mix beef brand, where we did a crossover study to find out whether it is really affecting humans the way it was appearing in the public domain. And the results gave us otherwise. And we are in the process of reviewing other products. For example, the Brookside has different brands of products, like the lactose-free, in quotes, milk. Of course, it's not lactose-free as such, but what we know is that it's a pre-digested milk, which separates the lactase from glucose, and it makes it easy for those who are lactose intolerant. But we call it lactose-free from the branding. We have reviewed that product. Now, we are continuing to review the products. We have done now, at the moment, audit of food products in the supermarkets, where we have found 1,415 food products with nutrition claims. We have also reviewed the companies producing such foods, and we have realized there are about 390 companies. Now, all this is what we are supposed to engage in a couple of years to ensure that all products value chain have been assessed. Now, we have products that are not in Kenya, and they are manufactured from outside. We also have a tool where we will assess the value chain process analysis for such products. Now, I want to say this. Why is this important? It is important because Kenyans need to know that what is on the pack is actually good for their health. Kenyans need to know what is in the pack is actually the same as what is in the content. And that is where now the various labs, including KEBS, comes in. The KEBS will assess the conformity. KNDI will go beyond the KEBS conformity assessment and also order for laboratory tests from other accredited labs, like ANA labs, like Bureau Veritas, like SJS, to authenticate what has been confirmed as conforming, where the S mark now has to be put on the product pack. So when that happens, then our validation process becomes more of human specific as compared to compliance or conformity. So I want to be very candid with the Kenyans that just by mere S mark or diamond mark, for example, on a product, it does not mean that that product is healthy. I know it might be strange for some people, but you can find a product with diamond mark or S mark, which is from KEBS, but still harmful to the consumer.
Okay.
And that is where the scientists must now come in and authenticate the product. So KNDI purely has that mandate. And I want to really submit this with a lot of humility. We have had cases whereby some organizations, some private organizations called COFEC,
Yes.
have gone ahead to malign KNDI and even go further to say that they do not have mandate. These are people who have not read the act.
Okay.
It is unfortunate because COFEC himself, herself as an institution, is represented in the KNDI Council. And they are part of the process of approval where these are discussed. So through their representation, they have been part of this process. Yet when they go outside there, they harass institutions that bear KNDI's logo, whose value chain have been assessed by scientifically proven methodologies and experts. We have had very highly qualified food scientists and highly qualified public health nutrition scientists that have gone through these value chain processes and authenticated that they are good for human consumption. Then a member of the same council now comes in public and threatens such institutions. I would want to condemn that process with the strongest terms. And we will take up that matter legally so that we stop harassment. Our aim is to enhance food products in such a way that they will be useful for consumption and they will protect Kenyans at all costs to ensure that we remain a healthy nation. So we do not want politics in the process. Thank you very much.
Thank you so much, Dr. Okeyo. That was firm and stern.
Yeah.
So now probably we have food companies or manufacturers who are currently watching this episode. What do they need to know when they are submitting their products for review? How is the review process like?
Okay. I want to say this. When this act was saying that we must work jointly with other bodies,
yes,
it was because of the extent when it comes to capacity. We said that it's a joint process, and so it will require a number of key players in it. However, we take lead when it comes to review of nutrition claims. So this calls for laboratories. It also calls for other expertise in the value chain, like public health experts. But the process is very simple. A company that wants a value chain process validated and the product itself also approved for good for consumption, as good for consumption, they just need to approach KNDI and they will get a form to fill with the company's name, the location, the directors of the company. They will also list the products with claims. And after that, they will register that company as either medium size or large size or small company. Those that are multinational are actually classified as large companies. And those that operate within certain counties are small, medium-sized companies. And those that are individuals, they are small. We have categorized them for purposes of making it easy when it comes to cost of value chain analysis. Okay. So once they fill that form and they submit to KNDI. KNDI will advise on the basis of their levels. There are costs attached to it, like the cost of registration, that is for the company. And then also we have a cost for the value chain itself. For any product whose value chain requires that we do a comprehensive analysis of both process, integrity, and content, they will pay 400 per 1,000 shillings per product. That is one product. And it doesn't matter how many products they have. Each will be having its own value chain analysis. Once that is done, then the product is endorsed. And the endorsement cost is 2.5 million Kenyan shillings. That includes indemnity by the institution. Now, that endorsement covers all products. And so if you have many products, it will be endorsed once. Just like when you have one or more, it doesn't matter. That is the cost for a large company. For a medium-sized company, the endorsement process is 1.5 million. And for small companies, it is 700,000 Kenyan shillings. With that, we incorporate the value chain process analysis, assessment, as well as teaching them on how to keep up to date with conformity. Not conformity, but with good human approach when it comes to the product output and marketing. So this is what we are intending to do. And we are also going to call on many partners to be part of this process so that we can assure Kenyans of the wholesomeness of the food products we find in the supermarkets and educate them properly so that when they consume, they do so with some knowledge, not just picking and eating. So the essence here is that KNDI has that mandate. And KNDI also has the capacity when it comes to expertise. And with the joint and collaborative approach, we are ready to assist Kenyans in making appropriate food choices when it comes to their human health lens. Thank you very much.
Thank you, Dr. Okeyo. As we're coming to the end of today's episode, do you have any parting shots?
Yes. I want to say this. The matters of ensuring that Kenyans are healthy is a big agenda for this country. And I think the Kenyan government is very much concerned about a healthy nation. To ensure that there's a healthy nation, we have key players that would make sure that Kenyans are well educated, and KNDI is one of them. Now, every institution have their own mandate, which is provided for in the various statutory instruments that they have. KNDI has an instrument which requires that they actively review food with food supplements. We do not want politics on this matter. And so we want to advise many other organizations that before they go outside there to threaten food companies who have taken initiative to ensure that their products are meeting the standards when it comes to claims of the package, they should address this matter with KNDI and get to understand deeper how the process was conducted.
Yes.
For every institution that we have assessed, we have full report of the value chain analysis, which is scientific. And we also have details or nitty-gritties of lab analysis from various accredited labs. So noise making outside there will not help Kenyans. We want them to support the process as they have indicated before, and we want Kenyans to embrace products that have KNDI logo because they have been authenticated. So as you go to the supermarket there and you find Weetabix as a logo, ask yourself, oh, this is a product that has gone through the hands of KNDI expertise. When you're consuming it, just get to know that we take responsibility for it. If you go to supermarket and you find fresh fries, and you find the logo there, just know that the value chain has been rigorously assessed. And so what you're consuming is having good content for your body. And finally, you should be informed that KNDI occasionally walk into the supermarket and take samples and monitor if consistency is maintained. So be rest assured that we are here for you as KNDI. We are going to save the nation when it comes to matters of human health and nutrition, including dietetics. Thank you very much.
Thank you. We've come to the end of today's episode, and we are now well versed with the role and mandate that KNDI plays in the regulation of the nutrition and dietetics as profession and as professionals. See you next time, same time, 7 to 7:30 a.m. to 8:30 a.m. or 5 to 6 p.m. every Thursday. Goodbye and have a lovely morning.